And then finally, the most recent player in all of this is pyrolutamide, KX826 from Kintor Pharmaceuticals. In 2025, it seems that the narrative has tilted a bit. Without a single head-to-head study, we can't conclusively say whether KX826, CB0301, or RU-58841 is better. We can't say which one is better out of all the three, but nevertheless, it seems KX826 has started to look like the more reliably advancing option, both clinically and operationally, even as we keep proper caveats about its efficacy versus oral 5-alpha reductase inhibitors like finasteride and dutasteride. Hey guys, before we continue this video, I would like to mention that we now have liposomal monoxidil sulfate on my website, folligens.com, folligenz.com, and if the order queue is available and open, you can order it there. We're running it as a cosmetic. There are other sort of botanicals inside of this particular topical that are pretty helpful when it comes to conditioning the hair. So that's at folligens.com, folligenz.com. That's folligenz.com. Go check it out and maybe even try it out. See you there. Hello everyone and welcome back to yet another video. For years now, the androgen receptor inhibition race for the condition of androgenetic alopecia and even acne itself has been a story, a race of some kind between three key players, three key compounds. Now, first and foremost, the oldest out of all of these drugs that I'm going to name today would be RU-58841. And this drug, this experimental compound, has been around for decades. It's not FDA approved, but there are some loopholes where you can get it through the gray market, or even some cosmetic loopholes where you can just get it outright. But it is, as the name entails, it's supposed to theoretically block the androgen receptor in the scalp of the hair follicles, and then after that, DHT shouldn't be able to frequently bind to those androgen receptors, and if you can limit that sort of DHT androgen receptor interaction in the hair follicles, ideally there should be some sort of rebound effect where the follicles can actually grow hair, at least in a sort of more improved state. Then you have CB0301, also known as Breezula, or potentially that is what the drug will be called once it hits the market sometime in 2027, and this is from Cosmo Pharmaceuticals, formerly known as Cassiopeia. Now, Cosmo Pharmaceuticals already has a drug containing clascoterone, CB0301, on the market, and this is the cream, the anti-acne treatment known as Winlevi. But they're still going on with their phase 3 clinical trial testing. Actually, I'm pretty sure they're done with that, but more on that later. And then finally, the most recent player in all of this is pyrolutamide, KX826 from Kintor Pharmaceuticals. In 2025, it seems that the narrative has tilted a bit. Without a single head-to-head study, we can't conclusively say whether KX826, CB0301, or RU-58841 is better. We can't say which one is better out of all the three, but nevertheless, it seems KX826 has started to look like the more reliably advancing option, both clinically and operationally, even as we keep proper caveats about its efficacy versus oral 5-alpha reductase inhibitors like finasteride and dutasteride. So Kintor spent early 2025 doing phase 3 clinical trial testing, so even more phase 3 clinical trial testing for their drug KX826. Now, they've done many phase 3s at this point, but this particular phase 3 that they did was a longer duration, had many centers for their phase 3 safety study, and this involved the use of 0.5% twice daily of KX826 at 52 weeks between 16 sites, and they hit their primary endpoint. Investigators reported a, quote, low incidence of adverse events. Specifically, when it came to sexual dysfunction, there were none that were reported that connected to the use of KX826. And also, there were some pretty statistically significant signals on key efficacy readouts, such as target area nonvellis hair count And that particular metric right over there, target area nonvellis hair count, is essentially them counting the hairs that are either terminal or intermediate hairs. And again, these are hairs that you can actually see, you can style, and they have some bulk to them. So they saw an improvement in that particular metric. At the same time, they saw an improvement in hair width per hair that had been treated with this sort of drug, right? So this was noticed across a full year, and this is what makes the sort of results kind of exciting. So the combination of a clean long-term safety, study plus a study that is actually showing efficacy lands itself exactly where a sort of chronic scalp therapy needs to be. That is, if you have to use this drug pretty much every day, so long as you want to keep your hair, you want to make sure that it's safe, where you're not having significant amount of side effects, but also at the same time, you want to make sure that it is efficacious, that you're actually getting benefits, pro-hair growth benefits to your hair follicles. And just 4 months later, Kintor announced that the Part 2 stage of its Phase 3 clinical trial testing for KX826 at 1.0% had met its primary endpoint with clinically meaningful efficacy and safety, and that the Phase 3 stage finished enrollment of 666 subjects across 25 different centers. So just to kind of summarize things in general, they were running clinical trial safety and efficacy studies, multiple Phase 3s, on 0.5% pyrolutamide, and they already reached a sort of efficacy that had been noted with that concentration, right? They did that for at least a year, and now they're trying to do a new study, another Phase 3, so they have so much data at this point on the safety and efficacy of this molecule, KX826, but now they want to do it with 666 patients across even more centers. And they're expecting a completion of this study by early 2026. And one thing that's important to kind of remember is that the investigators, not Kintor themselves, but site investigators are going to be sort of monitoring and seeing if there's any sort of signs of hair growth, right? People tend to mistake the whole clinical trial process, but there are third-party investigators, primarily from China's version of the FDA, that will be kind of overseeing things, right? So just keep that in mind. Now, Cosmo Pharmaceuticals' clascoterone remains a category pioneer and the only topical androgen receptor inhibitor to reach large global Phase 3 studies. So we've actually seen it get on the market again before as Winlevi, right? It already had some data regarding its acne efficacy. But when it comes to the hair studies, Scalp 1 and Scalp 2, the Phase 2 story started impressively when they were studying CB0301 for androgenetic alopecia. So at 6 months interim of the dose-ranging study, 7.5% twice a day posted a plus 20.8 hairs per centimeter square change from baseline. So that's the total area hair count. And this is a robust signal that initially hinted the potential of CB03 being a competitor, an option, an alternative, feasible alternative to finasteride and perhaps even dutasteride. However, at month 12, there was a decline in hair counts that began to occur, so this was kind of concerning. Instead of maintaining that strong signal at the beginning of those plus 20.8 hairs per centimeter square, at month 12, it landed between 10.2 up to 14.3 hairs per centimeter square between all of the active treatment groups in the study. And the changes in hair width were still somewhat positive. So, although there was a decline in initial hair counts, the results were still somewhat favorable. But a lot of people in the hair loss community, their attention zeroed in on the contrast between the eye-catching 6-month baseline gains and the more modest 12-month relative to vehicle figures. So this showed an apparent waning from the mid-study peak. Now, this isn't proof of it falling below baseline across all the different arms, but it does explain the 6 to 12-month fade narrative. Now, operationally speaking, Cosmo Pharmaceutical did begin phase 3 testing in mid-2023. Now, operationally speaking, we're still waiting for these phase 3 results, and it seems as if that Cosmo Pharmacy is done with their clinical trial testing, and we're waiting on a sort of decisive data set to be released to the public so we can actually see what's going on. But it looks like that CB0301 may get to market late 2026, early 2027, around there. But to be honest, I think they're kind of getting beat out by KX826 because Kintor did the smart thing of first going in as a cosmetic while they were still trying to prove the efficacy by still doing clinical trial testing. And then they, luckily enough, got that clinical trial efficacy data, and that only bolstered the sort of, benefits of KX826. So that thing has been on the market for at least about a year now, if I want to say. You can head over to the Koshine Market on the Koshine Mall. I'll put that in the description below. But there were also other websites that were selling, higher concentrations of KX826, different formulations of KX826, and it seems as if people, anecdotally speaking, are reporting that this seems to be a feasible alternative. And to be honest with you guys, when it comes to safety, KX826 has tons of safety data, lots and lots of safety data, more than you can get with RU-58841, and even more than CB0301, right? So just on the safety aspect alone, this thing is at least more reliable, or I guess you can kind of rest well at night knowing that if you use it, you're not going to get side effects, and if you do quote-unquote get side effects, it's highly likely to be a nocebo effect. Now, if you have that with RU-58841, we can't really say because we don't have actual data from the pharmaceutical companies like Prostrakin, now Kyowa Kirin, that owns the intellectual property data, the clinical trial testing data, because none of that became public, right? At least with KX826, you have that public data, and you have ample amounts of data that proves that it's safe. And even out of safety, when we're looking at efficacy, you even have that too, right? So we're dealing with some pretty reliable data when it comes to pyrolutamide, aka KX826. Now, can I sit here and say that KX826 is a replacement for finasteride or dutasteride? No. And it maybe will not ever be a real one-for-one substitute. Because one, we don't have long-term data on KX826 when it comes to safety. I mean, by long-term, I mean decades worth, right? We don't have that. And we don't have long-term data when it comes to efficacy especially, right? It could be the case that KX826 provides some protection for, let's say, 5 years, and then after that, it just stops working. Or it could be the case that it provides a mild protection so long as you use it, right? But we have more data with finasteride and dutasteride that I'm just more comfortable in saying that those are clearly the superior option. But if you can't tolerate finasteride or dutasteride, it does make sense to use KX826 to give you some sort of protection. It's better than nothing. I think it's better than RU-58841. It's more potent than RU-58841. It's more potent than CB0301. So why not give it a shot, right? It seems as if this might be the sort of best topical androgen receptor inhibitor. And there is a sort of benefit where you can stack it with finasteride or dutasteride, or maybe alongside minoxidil, or even low-dose oral minoxidil, or low-dose topical finasteride, low-dose oral finasteride. There is the benefit in combining it with other parts of your hair loss stack, and it may potentially give you more. But honestly, if I'm going to say from my perspective, if you're already on something like dutasteride, 0.5 milligram, and even oral minoxidil, 5 milligram, then maybe it's not going to add that much protection for you that's even noticeable. So it might just be a bit of a, a bit of an additive cost that you might be able to do without. But still, it will probably give you some sort of additional protection. So that's my take on KX826 pyrolutamide. And yeah, I do think it's an option that you guys can potentially look into and try out for yourselves. And that's pretty much it for this video, and we're at the end of the video though, but I have to plug my company too. I started a company called Folligens Therapeutics. That's FOLLIGENZ.com. And currently we're running liposomal monoxidil sulfate as a cosmetic. You can get it. It has other sort of botanical benefits as well. So you can head over to FOLLIGENZ.com to get yourself liposomal monoxidil sulfate. So, thanks for watching, guys, and I hope to see you in the next one. Peace out.